What you can expect after total knee replacement is hopefully a full recovery. You will be in the hospital for approximately 2 to 3 days. Depending on how well you progress while in the hospital, you'll either be discharged to home or discharged to a rehab facility. You are monitored while in the hospital by the residents, the doctors, the attendings, and the social workers to determine where you would be discharged to. Most times patients are discharged to home. When they are discharged to home, they'll have physical therapy come into their home for a couple of weeks. We control your pain with narcotic pain medication. The doctors and nurses work closely to give you the appropriate medication that will manage that pain. You're discharged from the hospital with pain medication, and our physicians will manage your pain for approximately 3 months after the surgery.
Physical therapy and occupational therapy are very important for the patient immediately following their surgeries and then often beyond discharge from the hospital. Physical therapy and occupational therapy come in within the first 24 hours from surgery and often on the day of surgery to get patients up and out of bed and moving. We like to say within 72 hours from discharge from the hospital, we would like you at your outpatient physical therapy appointment if you have had a total knee replacement. If you have a total knee replacement, we want you to get to outpatient physical therapy as quickly as possible. Because of the incision that the surgeon makes on the knee, scar tissue inevitably will lay down, but the incision is over the plane of motion of the joint for a total knee replacement. So if the knee scars down, typically because of pain and not moving the knee because it hurts, then you will have difficulty walking later on, going up and down the stairs, getting in and out of cars. And so we really stress to people who are having a total knee replacement that they must get to outpatient physical therapy to have their knee stretched, to have their scar massaged, and to have exercises that are appropriate to make sure that they don't get too stiff and have a knee that does not work for them. So the very first day that the physical therapist comes in to get you out of bed, they will also show you a folder that has your home exercise program in it. They'll review the home exercise program with you throughout your stay, as well as any other information you may need as it pertains to rehabilitation after your joint replacement. There's contact information should you have any questions or concerns once you leave the hospital to help you through your recovery. For all joint replacements, total hips and total knees alike, getting in and out of a chair, you want to protect your joint, at least initially, because it will be sore from surgery. So we like to teach patients before they sit down to kick their operative leg or the affected leg out so that they don't bend the knee too much when they go to sit down, and just keep the joint protected as they lower themselves into a chair or onto the bed. Otherwise, you want to scoot your bottom to the front of the chair. You want to have a chair that has armrests, and you want to push up from the armrest to the standing position with your walker or crutches in reach. During your stay in the hospital, you may hear the term DME, which stands for Durable Medical Equipment, and that is your rolling walker, your crutches, your canes, and they will all be covered by insurance. Your physical therapist will come in on the first day, make sure that you can get up and out of bed, and will make recommendations for the most appropriate equipment to get you in and out of bed and in and out of your home.
Most total knee replacements are closed with staples. That area should not be exposed to water until those staples are removed. The staples are usually removed at 14 days post-op, at which time we even suggest the patient not bathe for at least 48 hours from the time of the staple removal. You should contact the surgeon's office at any time with any question you may have. especially if there are concerns of infection, those being redness, swelling, drainage at the incision site. There's always a risk of blood clot following these surgical procedures. Those risks are very small, but it can happen. So anytime you would develop any calf pain, swelling, shortness of breath, if any of those should occur, you should go directly to an emergency room. Your pain medication should be taken always as directed by the physician. We do recommend when you're in physical therapy that you take your pain medication prior to your physical therapy appointment if you can time it appropriately. If you need to contact the nurse liaison office, it's important that you leave your first and last name with appropriate spelling, your date of birth, and the best contact number for them to reach you. When refilling a prescription, it can be done either through the lifebridgehealth.org patient portal site, or you can call the prescription line